If you think that your neck has something to do with your headache or migraine, then stick around, as this video might just change your entire reality. Now here's the thing, often it's obvious to you that your neck has something to do with things, but you're not taken seriously, and the impact is that it makes you feel crazy. You find someone who believes you, but they just can't hit the spot, and the impact is massive. Now if you can relate to any of these, click the link below and I'll show you how to overcome these common problems by asking the one question to work out if the neck could be contributing to you. Now then, which joints could contribute to headache and migraine? So this joint here is OC1. Now what that does, it's a nodding joint. So what it does is it nods the head like this, kind of in that kind of way. Now where the pain goes when you've got an issue with OC1, the very top of your neck, it feels like a really compressive feeling. It feels like your head's being squashed. Often it can feel like there's a baseball bat whacking in the back of the head, or this really heavy feeling at the front. And on the odd occasion it can actually switch around, giving you a localized pain in your temple on one side or the other. So that's OC1. The next most common joint that causes headache and migraine is C23. Now at C23, it's this joint here, it's just at the bottom here, and that causes a bit of rotation, a bit of tilt, but it actually does a little bit of movement in that direction as well, sliding forward and back. Now when you have an issue with that joint there, what happens is that you've got pain that comes up and over the head, like a big tract that comes up and over, and it can often finish right behind one or both eyes. It's really common to get this when it feels like the pain is popping out of your eyes, or almost like a cluster headache type feel, where you get a runny nose, a runny eye, perhaps a red eye or blocked sinus that can swap sides. So that's C23. The third joint that can do this is C12. Now, as you can see, C12 is actually a rotational joint, okay? So it's responsible for most of the rotation at your neck. So it does a lot of turning. Now, if you've got a restriction in the way that you turn your neck, you're gonna get a really local pain sort of in the top corner of your neck, just like this. So it feels like you really wanna poke at it and find the spot that's right up here in the corner to get it so you can turn a little bit further. Now if you've got a headache that's coming from C12, quite often it's kind of a vague pain sort of in the top of your head here, or it's a pain that's coming in right behind your eyebrows. Now of course what can happen is that if you've got all three joints that are causing the issue, that it can feel like that headache or migraine is like a patchwork quilt. Some days the pain can be here, other days it can be there, it can swap sides, it's all over the place, and it's not really, can I say, consistent depending on the day. So it can change from side to side, front to back, and it can make you feel very frustrated. Now if you're still watching and you aren't one of our valued patients, now is the time to click and start the process. Now you might be thinking, how will I know that treating my neck will actually help? Well, I've got the answer for you. We have objective measurements on day one that we assess, and we regularly measure as we go through your treatment. And we also regularly measure things like how often you get the headaches and migraines, how long they last for, how intense the symptoms are, and how much medication you take to relieve your symptoms. We'll be looking for all of those metrics to decrease. Now if they do, happy days, things are improving. And if it's not improving, then it's simple. We discontinue treatment and we send you to somewhere that can help. This is the end of the video. If you've watched this far, then this video was for you. Click on the link below, fill out our form, start the conversation, and get started. I hope you found this helpful, and I'll see you again soon.